The lessons we learned during Ebola, we've put them into very good use, and we see those results reflected in the kind of figures that we are seeing. You will see that Africa still has a fighting chance to actually bring this pandemic under a decent level of control. 25 countries have less than 5,000 cases. So these are figures that are amenable to to flattening of curves using public health measures, if we can be able to be strictly disciplined on the continent. So these 25 countries are really still having a very good opportunity. 6 countries are above 50,000. And only one country is about 500,000, and that will be South Africa. So when you look at the details in each country, we still do have an opportunity to actually reduce the suffering that this virus has brought to many parts of the world. Now, as part of our response as Africa CDC and Africa Union, on the 22nd of February, a week after the first case was documented, the Africa Union Commission chairperson called an emergency meeting of ministers of health. And at that meeting, 3 things happened. One is an Africa joint continental strategy for COVID-19 was passed. Second is a task force, an Africa coronavirus task force was established. And 3, Africa CDC was directed to coordinate efforts on the continent using evidence-based actions and policies. So in this way, on the 22nd of February, we were flagged off. And that strategy has these 3 broad pillars: preventing transmission, preventing death, and preventing social and economic harm. These 3 pillars are the ones that underpin the joint continental strategy. Now, today we are talking about the vaccine. And the vaccine, really, we have a COVID-19 vaccine strategy as well. And that vaccine strategy is basically to ensure that it's contributing to the general Africa Joint Continental Strategy on COVID-19 by those 3 pillars that I've talked about: preventing transmission, deaths, and social and economic harm. So the vaccine strategy has its place in our response, overall response strategy. And really, the 2 key things that we are looking at in as far as COVID-19 vaccine is concerned is that it will allow countries on the continent to, as quickly as possible, return to economic development. We have an agenda, Agenda 2063, and this has now been disrupted by the COVID-19 pandemic, and we want to return to that as soon as is possible. So this is one very key area of the COVID-19 vaccine strategy. The second is to protect the most vulnerable population. We have seen the proportion of those who are affected in the most serious ways, the critically ill, is floating in Africa between 13 and 14%. Those that will actually require hospital-based intervention. And we are trying to make sure that when the vaccine eventually arrives, we have understood who those vulnerable populations are, from our frontline workers in the health sector to frontline workers, particularly in the hospitality industry, to our teachers and students in educational institutions, to those who handle large volumes of human beings. So these vulnerable population include also the aged and those who have comorbidities of various types. So we want to make sure that these 2 areas, timely return to economic activities and protecting the most vulnerable, are really going to be strategically placed in implementing the vaccine strategy. Now, we have done some numbers, and what we are seeing out there now is that most probably the successful vaccines will require 2-dose regime. And when we look at the amounts of money that we need, it is staggering, considering the level of wealth that we have in Africa. We have 1.3 billion people in Africa, rushing quite quickly towards 1.4 billion, I think, by the end of the year. And if we wanted to vaccinate at levels that make public health sense, we will be requiring $23 to $35 billion. This is a very significant amount to put into one vaccination program, but it is necessary if we are to go back to proper economic activity. And these indicative costs are based on the proportion of the population that we need to vaccinate so as to get to levels where the virus has come under proper control in as far as public health is concerned. So this is the kind of investment that we need to be thinking and planning for, even as the vaccine candidates out there are going through their final rounds of clinical trials and testing. Now, why is this important? So if you look at this figure, 23 to 35 billion looks a lot. But that needs to be put in context of the 3 or so billion doses that we will need to be able to vaccinate everybody with a 2-dose regime. But if you look at the kind of loss that sub-Saharan Africa particularly is facing in light of the COVID-19 pandemic, then it is a worthwhile investment. Because the World Bank tells us that the cost so far is anything between 37 and 79 billion. And that is only for output. Only for output, because we've been in lockdowns, because we have been unable to travel as we do, we've been unable to carry out our economic activities. It is anything between 37 and 79 billion in outputs. Now you can imagine the loss in terms of networking and engagement with other parts of the world. If that is added on top of this, the number goes up. So instead of waiting to lose more of our economic activities, it will be worthwhile to actually start preparing for actual vaccination and not just generating a successful vaccine. So for our Africa CDC COVID-19 strategy, really our focus is a safe and efficacious COVID-19 vaccine, which is then successfully distributed across the continent to immunize a proportion of citizens that will be critically important to generate the kind of immunity that we need on the continent. So our focus is a safe and efficacious COVID-19 vaccine on the continent. Now, if we unpack the strategy a bit, it has 3 main goals. One is our involvement in clinical development. And to address this, we have formed a consortium for COVID-19 vaccine clinical trials. We call it CONVACT. And this is really to ensure that as Africa, we are participating effectively in all all clinical trials that are based on good candidate vaccines. And this will actually not only strengthen our capacity to be able to run clinical trials, but it also provides us with a good bargaining chip when the time for production comes. And that takes us to the second goal, that we want to ensure that we have access to sufficient vaccine supplies. Not that we wait after 2 years is when we are getting vaccines. So we need to prepare for that, and that is the second goal of our strategy. This means that we must prepare to procure, and we must prepare to procure in a timely way and in doses that are actually going to be appropriate for our countries on the continent. We must also prepare to manufacture. We do have facilities that can manufacture vaccines. The whole animal vaccine world is so advanced in Africa. It is amazing that we have a very good resource that we have still not used for purposes of human vaccine manufacturing. But we are in very close discussions now with the vaccine manufacturers for animals and those that have the capacity of being tweaked so that they can start manufacturing for humans as well. But vaccine manufacturing is key in our second goal. The third is to prepare effectively for delivery. Because of cold chain issues, we must ensure that as soon as a vaccine candidate has been confirmed to be efficacious and safe, then our regulatory processes must kick in so that we have those being approved on the continent. We must be able to deliver to every part that requires it, and we must engage with our communities so that the vaccine theories that are flying out there can be able to be addressed in advance. When the COVID-19 vaccine eventually comes, then we are really just delivering. So these are the three goals of our COVID-19 strategy on the continent. Now, if we look at the first goal, how we are preparing to support clinical trials. In the short term, really, we have engaged with at least 3 very carefully chosen COVID-19 vaccine candidates, and we are having those being done clinical trials on the continent. We are also supporting development of more clinical trial sites. And this is not only for COVID. We are looking at this in the broader perspective because other pandemics will come, other outbreaks will also hit us on the continent. And we want to be sure that we can be able to engage with the clinical trial sites in advance and be ready in case we need them. Third is we want the clinical trial sites to function at top level, completely top level, so that there are no doubts about our results on the continent. And of course, the issues around regulations and rollout and uptake and manufacturing on the continent are extremely important parts of the first goal, which is clinical development. If we look at what is happening on the continent right now, we have over 10 different vaccine trials that are in progress. And I will not go into detail of which ones they are out there, but the countries that are really involved are South Africa, Kenya, Egypt, and Morocco. And we are monitoring very closely these clinical trials, their progress, the challenges, and we are giving feedback to our heads of states through the Africa Union mechanism. Again, in terms of expansion of clinical trial sites, we are talking to at least 16. In fact, this week there will be 18 high potential clinical trial sites on the continent, and these are spread across Africa, so that every region, every country feels that they are contributing to clinical trials. So these clinical trial sites are have already been engaged in other types of clinical trials, but we want them to be part of the COVID-19 clinical trial sites. We are also engaging with developers of vaccines. And so far we've done 8. We have 2 more we'll start discussions with. I'll not go again into the details of these, but this is just to give you a clear indication that as Africa CDC, we are working very, very hard to ensure that we're having discussions with all those that are in this space of vaccine development, manufacture, clinical trials, and eventually delivery. The COVID-19 vaccine strategy for Africa is access. And we are looking at access from those 2 angles of finance and procurement. You may have the money, but then you can't be able to procure. You may have a possibility to procure, but you don't have the money. And both these will affect access. So right now we are working with our member states, all the countries in Africa, to commit their resources to vaccine financing and procurement. And then we are also exploring with different financial institutions, particularly the Afro-Exim Bank, the Africa Development Bank, so that we can be able to have financing instruments in place for countries that may not be able to come up with the money immediately, but they can be able to pay over time. And this is important because when the vaccines will become available, you will have literally hours to be able to come up with money to purchase. Otherwise, manufacturers will not sit with a stock that you're still looking for money. That is why we are working with these financial institutions to ensure that financing instruments are in place for countries that may not be able to mobilize their resources immediately. Manufacturing, extremely important, because with time, reflecting on the fact that each and every country and territory in the world has been affected by COVID-19, it means each and every human being on this continent will actually want to access a vaccine dose or two, depending on the regime. So it means that if we ramp up our manufacturing capacity on the continent, we can be able to continue to manufacture for ourselves after we get the required licenses. So we are engaged with countries that have the capacity so that we can be able to begin adjusting their systems and their infrastructure to receive the correct support from vaccine developers. That way manufacturing can be done on the continent. And we are now, as I'd said, engaging with animal vaccine manufacturers as well, so that we see if the infrastructure can be able to be upgraded and we begin manufacturing what we need in Africa. It will reduce costs and it will improve the access to these vaccines. On the regulatory front, we are engaged with the different platforms on the continent to ensure that decisions for regulations are fast-tracked and therefore vaccines can be available legally quickly. And these regulatory decisions are extremely important that they are made in advance, so that when the vaccine is actually available and a successful vaccine candidate has been identified, we already have infrastructure and processes in place within countries to be able to do the regulatory approvals. And this means that we have to set up very good monitoring and evaluation system so that we are constantly in touch with each and every country, and if a vaccine may be showing signs that it may not be appropriate, we quickly intervene and we mitigate any harm that could be caused. So apart from regulation, we are also ensuring that we have a very good monitoring and evaluation system. Delivery. If you have the vaccine and you're not able to deliver it to those who need it, then the vaccine is not helpful. And we are working with Gavi, WHO, and the national immunization programs so that we can actually transform the existing immunization programs at country level. That way, they can be able to be used to reach all the target populations when we have a candidate COVID-19 vaccine that has been passed as successful. And we are currently working to provide guidance on how to adapt the current immunization systems to accommodate a COVID-19 vaccine. We already are seeing the types of vaccines that are being developed, those that are making progress, what kind of infrastructure we may be able to need, what type of financing mechanism may be useful, and we are in the process of finalizing what would be good for Africa, because what is good elsewhere may not be necessarily possible to implement on the continent. So, but tied to this, again, M&D, extremely important. As we develop the systems of delivery, we are also ensuring that we've worked in there, monitoring and evaluation, so that our citizens are confident that we are covering all aspects of possible harm that a new vaccine may be able to cause. Now, it's extremely important that we address community concerns and fears upfront. And we are in touch and with different partners who are in the space of communication, and that this has the endorsement from our heads of states. The Bureau of the Africa Union heads of states has already given us go-ahead to move this forward. And some key activities that we are driving is communication. We want political support at a country level. We want opinion leaders to be involved at country level. And then we want to ensure that the campaign is reaching everyone across all types of platforms for communication. And this means that from country to country, we will have slightly different methods of managing public expectation of providing information to members of the public. How we disseminate this information will be different from country to country. So we are also working with all the 55 countries to ensure that we have local technical working groups who are then going to provide the guidance that is required for community engagement. We need to do this early. We learned it in polio. We've learned it with measles. We've learned it with Ebola recently. And we are quite starting this very early so that we do not get caught out when we already have the vaccine in place. Within the country, we are asking that they start mobilizing domestic resources. And this is what is going to be sustainable. Let's not wait for the initiatives that are out there. We are telling countries, do it now. Look for your domestic resources, whether it is through taxation, whether it is through financial instruments, whether it is through bilateral arrangements, whatever it is, whether it is through public participation, mobilize domestic resources, because 35 billion is not small change. Then we are asking countries to prepare delivery and uptake. So it means our immunization programs must be redesigned so that it can be able to accommodate the COVID-19 vaccines. And communities must be involved. Any concerns must be addressed, and any conspiracy theories must also be tackled quickly and with facts. 3 is regulation. We are asking countries, do it rapidly. We are in fact exploring right now if we can be able to do it in bulk so that we get regions, the economic blocs, East African communities, SADC, ECOWAS, so that these Central Africa, the CEMAC, if they can be able to do it as a bloc, it moves faster. Now, we also are securing access to the vaccine. This means all the advocacy I've talked about, talking to developers, talking to manufacturers, trying to get them to commit appropriate numbers to Africa. We are also engaging our friends, whether it's in the donor space or it's in the philanthropy space. We are discussing with them how they can be able to work with us and ensure that we have adequate resources and technical abilities to deliver on this vaccine, COVID-19 vaccine. And eventually, we are also ensuring that our clinical trial sites are gold standard. The data that is coming out of Africa is respected and believable, and we are ensuring that we are utilizing our local talent, our local experts to be able to drive these clinical trials on the continent, because this will open up the door tomorrow for us to be able to do even more clinical trials for other candidate vaccines, not just COVID-19, but other candidate vaccines and therapies.